Hi guys, and welcome back to my channel. I am Sammy, and today we're going to be looking at infertility in women. Now guys, if you're new here, please go ahead and subscribe, like and share, and please remember to turn on your post notification bell. What causes infertility in women? But before we get into that, let's first understand what is infertility. Infertility is the inability to get pregnant after 1 year of trying despite having unprotected and regular sexual intercourse. As we all know, fertility changes with age. Male and female both become fertile in their teen at the beginning of puberty. In females, the beginning of their reproductive years starts with ovulation and menstruation. Their fertility journey slowly comes to an end 5 to 10 years before menopause, according to studies. While in a male, their fertility journey is a bit more complex because boys don't have a major event like a girl who starts menstruating. But changes can be seen like their voices begin to deepen, also start to grow facial hair and pubic hair. But guys, even with all these changes in a male, it is still possible that they could be fertile long before that age. Now, back to my question, what causes infertility in women? Let's quickly examine some possible causes. So the first possible cause we're going to be looking at is ovulatory disorders. In order to understand these disorders, you must first understand what role ovulation plays in a female. So, ovulation is a process in which one of the ovaries release a mature egg. After the mature egg is being released, it then travels through the fallopian tube. At this point, the egg becomes available for fertilization. This process occurs once in every monthly menstrual cycle, which is triggered by the change in the estrogen hormone. So now that we know that ovulation plays a crucial role in fertility, let me quickly tell you about two ovulatory disorders. So the first ovulatory disorder is anovulation. This type of disorder is a common cause of infertility. Anovulation is often the result of an imbalance of the hormones that allows a woman to ovulate. With an imbalance of the hormones responsible for ovulation, ovulation may become impossible, causing anovulation, which is the absence of ovulation. And we all know that ovulation is the release of an egg. Now, for the second ovulatory disorder that I am going to talk about, it is called oligoovulation. This type of disorder is a condition in which ovulation occurs irregular or infrequent and usually is classified as having 8 or fewer periods in a year. Just a quick point, guys, not because I've spoken about two ovulatory disorders, meaning there's only two. There are more ovulatory disorders that could be the cause of infertility in women. Okay, guys, so let's now look at some other possible causes of infertility in women. Polycystic ovary syndrome. So, guys, polycystic ovary syndrome is a common condition that occurs in some females. This condition affects how a woman's ovaries work due to an excessive production of the male hormones in the ovaries. So, what I am simply saying, guys, is that when there is a high level of the male hormone called androgen, it prevents the ovaries from releasing eggs, causing irregular menstrual cycles. So, if your reproductive hormones become imbalanced, you will miss periods, hence making ovulation unpredictable. So, guys, we're now moving on to another thing that may cause infertility. This one is a tubal blockage. The fallopian tube is important in order for fertilization to occur. If the egg is unable to travel down the fallopian tube, fertilization may become impossible, and it's the same for a sperm. If the sperm is unable to travel up the fallopian tube to meet the egg, then fertilization won't occur. Tubal blockage can happen for a variety of reasons in different locations. For example, proximal blockage. This type of blockage is near the uterus. Then you have the mid segment, and of course, it is in the middle area of the fallopian tube. Then you have the distal blockage, and this is near the end of the fallopian tube. So, guys, the final possible cause of infertility that we're going to talk about today is the advance in maternal age. According to studies, female aged 35 and older falls into the advanced maternal age because unlike men, women fertility begins to decline due to deterioration in quality and quantity of their eggs. So guys, one quick reminder, if you have not yet subscribed to this channel, please do so. And also go ahead and like and share this video.